Judith Oviawe to the show. Dr. Judith Oviawe is the President Association of Resident Doctors in LUTH. She's known for her specialty. I will not say much about her because she has a lot to dish out today. And also to introduce our topic today, we will be starting with health matters. We will be talking about hypertension, high blood pressure. As I said in my introduction in some other platform where I posted this, a lot of people actually believe this is a sickness of those in their old ages, those of 60, 70 years old. I said, no, I'm just 40. I don't think I'm really affected with hypertension. But if you look into the circle of your friends, circle of colleagues, circle of families, you must have seen one person or the other that has been affected by this ailment, by this disease. So today we will go deeper into the topic. We'll talk about the menace, we'll talk about the risk, we'll talk about the prevention, we'll talk about, I don't know if it has cure. I'm not a medical doctor yet, that's why I have a medical doctor in our midst. Without wasting much of our time, ladies and gentlemen, please join me as I welcome Dr. Judith Oviawe. Over to you, doctor.
Can you hear me now?
Okay, yes, it's better now.
All right. Okay. So I said I'm glad to be here. Thank you very much. I want to believe that you can see my screen. Papa, can you see my screen?
Yes, I can see your screen from here, and I hope everyone also on Zoom can see your screen. And I also just confirmed that on Facebook, yes, we can see your screen.
All right, thank you very much. So it's just an overview of hypertension. So we're just going to touch the surface, and I'll be speaking as I'll be talking to someone who's not a medical practitioner. So I'm trying to bring it down to home as much as possible. And today, the topic we're going to be discussing is hypertension, an overview. And I'm going to use this outline: definition of hypertension, causes of hypertension, the risk factors associated with hypertension, measurements, symptoms, prevention, management, and complications, all of hypertension. And then to start with, this is just a picture showing a blood vessel, okay? And I would like us to liken this blood vessel to a pipe or a hose. Let's take a hose, for example. So when you connect a hose to water or to a liquid matter, the pressure at which that water is passing through, or the pressure at which the water leaves that tap, is actually what determines the pressure within the hose. And that's the same thing that is likened to the blood vessels, okay? Now, blood is carried from the heart. As we all know, the heart is where is what pumps blood to the vessels, the big vessels that go to the smaller vessels and to the smaller vessels. So, the blood leaves the heart, okay? And each time the heart beats, it pumps blood into these vessels. Now, as the heart is beating and the blood is being pumped, the blood pressure is created by the force of the blood against the wall of this vessel as the blood is pumped by the heart, okay? Now, let's define hypertension. Hypertension is also known as high blood pressure or raised blood pressure. And it can be termed as a persistent increase in blood pressure above the normal range. So there is a normal range of blood pressure. So when you have any pressure above that normal range, which is persistent, not just a one-off, but over time, consecutively, then we can now call it hypertension. And it could happen to any age, but it gets more common with advancing age, okay? Now, the more the pressure, the harder it is for the heart to pump the blood out. And when you have the constant increase in pressure, persistent pressure, it actually eventually causes some abnormal changes in the vessels of the heart, the blood vessels within the heart. So it's actually very important that the blood pressure is kept under control in order to preserve health and reduce the risk of dangerous conditions. You know, yes, so before we move on, we talked about the range of blood pressure, and I would like to discuss two parameters that will be common, or two parameters that come to mind when you talk about blood pressure, and that is systole and that's diastole. Okay, so what happens in systole? Systole occurs when the heart is squeezed, the heart contracts, thereby pushing blood out of the heart through the vessel. That is systole. Now, as blood is pumped out, the heart also needs to take another blood to process another set of blood. So once the heart has pumped out blood, it relaxes, opens up, and then blood flows into the heart. So when the heart contracts, it's pushed out, and that is systole. When the heart relaxes and blood flows in, that is diastole. Now let's talk about the causes of high blood pressure. Well, oftentimes we say that the cause is not known, but in many cases, it's actually as a result of an underlying condition. So there is an underlying problem that is now leading to the high blood pressure or to the hypertension. Now, doctors classify high blood pressure into two: the primary hypertension or the secondary hypertension. Okay, and we say that if the pressure, the blood pressure, the increase in blood pressure or the hypertension is not associated with any other condition, that means this person just has a high blood pressure, there is no other associated medical condition, then it's termed as primary hypertension. However, if there's an underlying condition that this person has that is causing an increase in blood pressure, the doctors call it secondary hypertension. And there are a lot of factors that actually lead to secondary hypertension. Examples, chronic kidney diseases. This is one of the most common causes of high blood pressure because it's the function of the kidney to filter out fluid. The kidneys is like the filter system of the body. So once fluid is not being filtered out, then there will be excess accumulation of fluid and it leads to hypertension. And then you also have other conditions like diabetes. You have some thyroid problems, and so many others that can lead to hypertension. Now, we talk about the risk factors. A risk factor is something that you do that exposes you to a disease condition or to a problematic health condition. And these risk factors for hypertension can either be modifiable or non-modifiable. So these risk factors are divided into two. The modifiable. Now, modifiable risk factors are factors that you can modify. These are things that you can modify. You can change them in order to improve your heart health. Okay, and then the non-modifiable factors are factors that cannot be modified. So they are just there. We have to can't modify them. Okay, so we talk about modifiable risk factors. The best way to prevent hypertension and other diseases of the heart is to actually reduce these modifiable risk factors. And one of them is physical inactivity. Okay, that is, one is not as active as should be. I will talk about that much later. Then excessive tobacco and alcohol consumption, being obese or overweight, and then consumption of unhealthy diets, diets that are rich in high in fats, saturated fats, trans fats, reduce intake of fruits and vegetables. All these are things that can predispose you to hypertension, and they are modifiable, which means that you can choose to improve your physical activity. You can choose to reduce your tobacco and alcohol consumption. So those are things that can be modified. Before we go further, I'll just put a quick picture on the fats, kind of fats. Here you have trans fats, you have saturated fats, you have unsaturated fats. And the healthy of them all are the unsaturated fats. So saturated fats are a type of fats which actually they are very common, and it's actually unhealthy. Together with the trans fats, they are these two kind of fats are actually at room temperature. They are solid. So we're talking about the butter, the palm oil, the coconut oil, cheese, red meat. They have high amounts of saturated fats, which are formed when vegetable oils are hardened, and it increases the bad cholesterol, which are the low density lipoproteins, and it reduces the good cholesterol, which is the high density lipoproteins. And then when you have more of the bad cholesterol, it increases the risk of heart diseases and eventually stroke. And examples of these trans fats, as you can see, are fast foods, the cakes, pastries, chocolates, fried foods, and so many others. So all these are examples of the fats that you should stay away from, especially as you increase in age. And you can see that the unsaturated fats are actually the healthy ones and the good fats. Now, let's talk about the non-modifiable risk factors. These are factors that you cannot modify. And examples are the family history of hypertension. That means for someone who has a relation, a parent or a sibling that is hypertensive, it's a pointer to the person most likely having hypertension. For people that are over 65, in fact, for people that are over 65 years of age, people that have other diseases like with diabetes or kidney disease, and then sometimes pregnant. So for people that have these non-modifiable risk factors, we have to take extra precaution in ensuring that you monitor your blood pressure, and also is important that you actually adhere to the modifiable risk factors, which I've earlier mentioned. Now, we talk about the measurement of hypertension, and detecting hypertension is done with a quick and painless test of blood pressure. So you measure your blood pressure with a sphygmomanometer or a blood pressure monitor, and this can actually help you to keep track of the blood pressure. It's not always necessary that you have to see the doctor to have a blood pressure check. So it's something you can do on your own. It can be done at home. And these are some examples of your home blood pressure monitors that are available. You have the one on the wrist, you have the one that you use on the arm. So these are the ones you can actually get. They are readily available. You can get them in any pharmacy, and you can check your blood pressure daily, regularly. And a health person can also help you to assess the blood pressure. It's important to note that you may have an increased blood pressure for a very short time, and that could just be in response to some condition or some situation. For instance, having rigorous exercise or stress. So these two can actually temporarily or momentarily increase one's blood pressure. So you can actually not be hypertensive and still have occasions where your blood pressure is temporarily raised due to factors like this. And it is for that reason that we don't diagnose hypertension based on just one reading. So that means you still have to take several other readings before we can confirm that.
Hello, doctor.
Okay.
Hi, doctor. Just to check, we are getting some complaints that the audio is not too clear.
Okay.
Yeah, so could you probably move closer to your internet?
Okay, is this better?
Far better now.
Okay, all right. So okay, so let's okay, so I said that okay, so we talked about the modifiable risk factors and we talked about the non-modifiable risk factors. And I said that the modifiable risk factors are factors that can predispose you to hypertension, but they are factors that you can modify. You can work on yourself. You can work on those factors in order to help yourself to prevent hypertension. And like I said, I also said that the non-modifiable factors are the ones that you can't help it. You cannot reduce your age. You cannot stop yourself from having a condition, you know, and you can't undo the fact that you have a family member that is hypertensive. So those are the non-modifiable. But even though you have those non-modifiable factors, you can also pay good attention to the modifiable factors. So it can actually help you to reduce the risk of having high blood pressure. I said that the measurement of high blood pressure is done using a sphygmomanometer, and it helps you to keep track of your blood pressure. A doctor's visit is not always necessary for blood pressure measurement, so you can also do it at home. And we have lots of blood pressure monitors that you can use at home that are available. You have the one, this is one that we use on the wrist, and then we have the one on the arm. Okay, so you can actually get one and check your blood pressure regularly. Okay, I always suggest that once you are above 40, you should actually have regular blood pressure checks as much as possible. Okay, and then somebody, a health professional, can also check your blood pressure for you. Like I said that some people often have momentary increase in blood pressure as a result of maybe stress or a rigorous exercise. So it doesn't necessarily mean that they are hypertensive. It just happens once maybe after a rigorous exercise or when the person is exposed to stress. And because of this reason, we don't diagnose hypertension until we have carried out several readings, until we have tested, checked for the blood pressure severally. So we don't just base one reading and say this person is hypertensive. It's something we should have done severally, okay? This is one of the guidelines for the American Health Association. We'll just breeze through it. The normal range of, you'll be seeing more of systole over diastole. Now, when we're measuring blood pressure, those are the two parameters we look out for, the systole and the diastole. And like I said, the systole is the pressure when the heart contracts to push out blood, and the diastole is the pressure when the heart relaxes to take in blood, okay? So the normal range is 120/80 or less. So some people can have 110, 100 systole, and the diastole of 80, 70. However, by the time someone starts to have an elevated blood pressure of between 120 to 129 systole, then we need to start paying attention to the modifiable risk factors. So those are the things you need to start looking at. They are like the high normal, okay? But they are like a red flag, you know, to monitoring your blood pressure. So by the time your blood pressure is going above 120 and less than 130, then you need to actually start paying attention, good attention to your modifiable factors, and then you have to start to observe your your dietary guidelines and monitor your blood pressure regularly. Okay. So now you have the high blood pressure. It comes in 3 stages: stage 1, stage 3, stage 1, stage 2, and stage 3, and with increasing severity. So for someone with stage 1, as you can see, it's a systole of 130 to 139 of systole and diastole of 80 to 89. So this person, if you have taken several readings and you find yourself within this range, that is stage 1 hypertension. For stage 2, it's 140 or higher for systole and 90 or higher for diastole. And for the really, really bad one, which is the hypertensive crisis, which it's a really, really, it's one that you shouldn't take lightly. Where you have the systole of more than 180 and the diastole of more than 120 millimeters of mercury. Such a person, I would say, is a ticking time bomb waiting to explode. Okay, so we have to understand that. Okay, so now let's talk about the symptoms. For someone with hypertension, the person may actually never notice any symptoms, and so oftentimes is called the silent killer. So it creeps in unnoticed, and by the time you start to see symptoms or signs, then it's almost getting way out of hand. Okay. So without detecting, without detection of hypertension, it can actually damage the heart, it can damage the blood vessels and so many other organs in the body, especially the kidneys, you know, and in severe cases, it by the time it starts presenting with sweating, blushing, nose bleeding, early morning headaches, you know, you need to start you need to actually see a professional, okay? So these are the symptoms, I mentioned some of them, okay? So by the time you start to have the headaches, then one has to start getting worried, okay? Now, hypertension can cause a stroke. And what happens is that the blood vessels or the arteries that supply blood to the brain actually get blocked or they narrow, and it may actually lead to a stroke. It can also cause kidney failure, so many adverse conditions that can result from hypertension, okay? Chest pain, muscle tremors, and then finally death. Okay, now let's quickly look at the complications. So that is the bad one, once it gets really out of hand. So we have heart failure and heart attacks, okay? Now, long-term hypertension, that's untreated, unattended to, you know, it can cause complications through atherosclerosis. Atherosclerosis is a condition in which the wall of the blood vessels is lined and filled up with plaque. So there is what we call plaque that actually lines the inner wall of the blood vessels, and it makes it narrow. It narrows the blood vessel. And we're talking about pressure here. So the narrower the vessel, the more increase in pressure, and the worsening of the hypertension, because the heart must definitely want to pump blood to circulate the blood around the body. So as the blood vessels are narrowing, the heart is striving to make sure that it meets up with the blood requirements of the body, and then it keeps narrowing as it's trying to pump, it keeps narrowing the vessels, and then eventually may actually block the vessel itself. Then I talked about aneurysm, or an abnormal bulge in the wall of an artery. So because of the increase in pressure, you can have the bulge around the wall of the artery, which is like an abnormal blister. And because that part of the artery is like the weakest part now, it can actually rupture. And it depends on which part of the body it ruptures and cause a complication. Okay. So then we also have retinopathies in the eye that are also associated with high blood pressure, which can actually lead to blindness. So these are just some of the complications which you need to have at the back of your mind. Now we talk about how to prevent or how to reduce or how to adjust to when you're hypertensive, or to prevent the onset of hypertension. And I would just call them the simple lifestyle adjustments, okay? And then, like I said, lifestyle adjustments are most of the time the modifiable factors are factors that just entail you adjusting your lifestyle, modifying your lifestyle. So my internet is unstable. Okay, so the first one I'll talk about is the regular exercise, increased activity. So you need to be more active instead of just lying down or sitting down. It's good to be active. As you increase your activity, as you increase your exercises, you notice that your breathing is increased. So when you do exercises, your breathing is increased, your heart is stronger, and it pumps the blood with little effort, and it reduces the pressure on the arteries, and at the same time also reduces your blood pressure. So increasing your activity can be as simple as, instead of taking an elevator, you use the stairs. Instead of driving to the next street, you want to take a walk, want to take a stroll. Then instead of making your nanny or your house help to do all your chores for you, you could actually take on one or two of those chores. You can do some gardening, you can go for a bicycle ride, you can go swimming, you can play a sport, dancing. There are so many things you can do to actually improve your activity. Okay. Another thing is to manage your body weight. If you're overweight, you may have to shed some of your weight. With that, by reducing your weight, you reduce the risk for having other medical conditions. Remember, we said that one of the things that could expose you to having hypertension is being overweight and obese. So if you can put your weight in check, then you'll be doing yourself so much good. Okay. Then talking about stress, Nigeria is stressful. Then Lagos is very stressful. So we all know that. Okay. So, but avoiding stress or learning how to manage stress, how to cope with stress, can actually help someone to control your blood pressure, and there are so many things you can do in order to actually reduce your stress level. Examples, music, meditation, having a warm bath, taking on yoga or something, taking long walks, reading. So there are so many techniques. Whatever you do, some people even do take deep breaths, take a deep breath in and breathe out, and so on. So just as much as possible, try to reduce your stress levels. Okay. Then good sleep, very important. When you sleep, your blood pressure practically goes down. So when you lie down to sleep, your blood pressure reduces to a certain extent, and then if you don't sleep well, it can affect your blood pressure. So most of the people that fall within this category are those who are middle-aged. You have to get up, you have to go to work early and all that. So you may have to sleep earlier so that you can be able to get at least 7 to 8 hours of sleep every day. Good sleep will actually help to reduce the risk of having blood pressure. All these are lifestyle adjustments. These are things you can actually do to modify your lifestyle and then help to reduce high blood pressure. Other examples of your lifestyle adjustments are your reduced intake of sugar and carbohydrates generally. Then also your reduced salt intake, you know. So I've seen a couple of people that you've served their food, but they still go for 1 or 2 more helpings of salt. So you have that table salt with those tiny holes on the cover by your dining table. So I think it's high time that you discarded that. Okay, so reducing your salt intake is very important, very important in reducing high blood pressure. Okay, alcohol and smoking should be reduced as much as possible, you know, and not just alcohol, you know. So we should avoid excessive alcohol consumption, excessive alcohol, excessive tobacco, and not just tobacco, all those recreational drugs that they can predispose you to hypertension. You know, they contribute to your increased blood pressure, and eventually the hypertension sets in. You know, and junk foods, all the processed, as much as possible, it's preferable to eat natural foods, not those that are processed, canned foods, and all those things, as much as possible to stay away from them. It's good to eat foods that are rich in potassium, especially. You know, so many foods are naturally high in potassium. Example are the low-fat foods, as the low-fat dairy foods like the milk, the yogurts, fish, fruits like bananas, avocados, oranges, vegetables, sweet potatoes. Those are all foods that are rich in potassium. Your spinach and your green vegetables, you know. And you have a whole lot, your high fiber foods, your grains, beans, you know, the nuts, so many foods are rich in potassium. Okay, and then like we said earlier, with the picture I showed earlier on with the trans fat and the saturated fats, it's good to actually stay away from those fats. And above all, you eat in moderation. So you know, not that you want to finish the whole food. You know, it's good to actually eat in moderate portions. All of that would help you to reduce your put your blood pressure in check, or to reduce your blood pressure. However, there are some cases where all of these, your lifestyle adjustments, may just not suffice, and that is where the medication comes into play. Well, on no account should you treat yourself for hypertension, or on no account should you self-medicate. So it's important that by the time you notice that your blood pressure is increased, that it's increased over time, then it's good to actually consult your doctor, who carry out further tests on you to find out the degree and if there are other underlying causes of the hypertension, which if treated can actually bring your blood pressure back in check. Okay, so most times when you see the doctor, they start with a low dose of antihypertensive, and some of these drugs actually have some side effects which they will tell you about, and look out for them. Okay, eventually, as we grow older, you may actually need to combine 1 or 2 of these drugs, and like I said, it varies from person to person. So it depends on the individual and the underlying condition that such a person has. You know, so those are the things you need to take into cognizance. I would like to say that as you approach 40, it's very important that you put your blood pressure in check, because a lot of people don't actually know that they are hypertensive, whereas they are. On a final note, regular blood pressure monitoring is very important for everyone. The truth is that it could affect anybody, especially as we get older. So, and like I said, there is not really a cure for hypertension. However, it's not a death sentence. So we've seen people that have lived all their life with hypertension and they still lived, even with the hypertension, up to 60, 70, 80 years plus, you know. So it's just important that all measures should be taken to put your blood pressure under control by regular checkups. For those on medications, you use your medications diligently. You know, we have some people that they go to see the doctor, they diagnose them hypertensive, they place them on medications, and they take it for a while, and they stop taking it. I think that's really not so good. It's important that you continue with your medications, and you review your medications regularly with your doctor or your cardiologist. And also regular reviews. And that would be that. I would like to say thank you for your attention. And I think I can take questions now.
Thank you very much, Doctor. That was really, really, really a masterclass. So thank you so much. You've said quite a lot. I also have my notes full already, but I'd like to give opportunities to those of us in the class to actually ask questions. So if you have questions, there's the time for the questions and answers now. So please put your questions in the chat box, and I will moderate and take your questions. Then our guests can actually attend to each of those questions one after the other. So please, let's have the questions coming. I have some here already. And the first one, Doctor, I think you mentioned it, but maybe you need to also take us through briefly again. And the question is, are there symptoms? And if there are, what are those symptoms?
Okay. All right. Yes, so like I said that okay, I'm trying to take us to the slide. Okay, so I said that most times people with hypertension may actually not notice any symptoms. So if you don't take it upon yourself to check your blood pressure regularly, you may not know that you are hypertensive, or you may not know that your blood pressure is raised. And that's why we said that it's important to actually, as you get to 40 and above, it's good you check regularly. So I would advise you to actually have a blood pressure monitor on you to check your blood pressure regularly. However, that's why we said hypertension is AKA the silent killer, because it can actually go undetected, you know. But by the time you start to have symptoms, it may just be that your hypertension has been there for a long time and is probably getting worse. And like I said, by the time you start having headaches, maybe early morning headaches, bleeding nose like you don't used to have before, you know, visual changes, maybe you can't see clearly again, all those things could be telltale signs of hypertension. You have buzzing in the ears, nausea, vomiting, you know, anxiety. Someone just backs out. She just doesn't know what's happened, doesn't know what went on for a particular second. So you get to hear, oh, doctor, all of a sudden it's as if I didn't know what just happened, and then I came back. You know, all those things are pointers to hypertension. Okay. Then by the time one starts to have stroke, you know that it's been left long unattended to. Okay, so those are the symptoms. I hope that answers your question.
Yes, I hope so too. Okay, I have another question here. It says, is there a problem if systolic diastolic is lower than normal? For example, 160. Is there any problem with that? And the second question, okay.
Okay.
Yes, you can take that question. Then
Okay.
I'll answer that one later.
Okay. Yes. From this American Health Association guideline, you can see that we say 120 or less than 120. So we have some people whose blood pressure still goes down to 100 or 110. So if that has been your normal, then it's not a problem. It's not a problem. I've seen people that have blood pressure of 100/60 and they're doing very well. It's not like the blood pressure has been 120 and then suddenly it starts to drop drastically. That is hypotension, which is another condition. Maybe if Tope is ready to set up a discussion on that. But you can have blood pressure as low as 90, 100, 110, and still falls under the normal range. So that answers that question, I guess.
Okay, thank you so much, doctor. I have another question here. It says, can children be hypertensive? Let's say ages 10 upwards, can they be hypertensive?
Children be hypertensive? Yes. Well, if there are underlying conditions.
Hello? Dr. Judith, I think we're losing you.
Yes, children can actually be hypertensive, like a kid.
Okay. I think the internet connection.
Can you hear me, Tope?
Yes, but your internet connection is actually dropping.
Okay. Okay. So I presume you can hear me now, right?
Yes, clearly now.
Yes.
Please take that question.
So slow connection. Okay, just.
So for those of us in the class, while she sorts out.
Okay. Yes. So children can actually, and that's as a result of. Let me change my.
Okay, we'll give you about 30 seconds, Doctor, to change your internet connection. So for those of us in the class, please keep dropping your questions. We treated hypertension today. Maybe some other time we can actually bring up another topic of hypertension. And I'm very, very sure and confident that a lot of us had been really informed now. So please drop your questions, and also at the same time, if you have any topic in mind that you feel we should treat on this platform, topics bothering you, topics you also want someone else to learn from, please feel free to drop us a message, either by email, by WhatsApp, or any other medium. Doctor, are you back now?
Yes, I'm back, but I'm trying to get back. Yes, so while I'm at it, yes, you can actually have children that are hypertensive, okay, and that's oftentimes associated with other underlying conditions, okay, maybe like chronic kidney disease and so many other conditions that can predispose to hypertension, okay? So yes, you can have children that are hypertensive.
Okay, thank you very much. I hope that answers the question very well. I have another question here. It says, for whatsoever reason, is it advisable for blood pressure patients on his or her own to buy drugs based on previous prescription?
Well, the truth is that when you present with hypertension, your doctor or the person seeing you actually gives you a prescription, and because one may not be able to understand how dynamic your blood pressure may get back to normal, the dynamism of getting your blood pressure back to normal. It's actually important that you have regular appointments with your doctor. So your doctor has to see you regularly, so they can give you like 3 months appointment, 6 months appointment, and at that point they now reassess your blood pressure, and they will now determine whether you need to modify your drugs, to reduce your drugs, or increase your drugs. So it's not just good to have a one-off appointment with your doctor and then you run off. So whenever you are given an appointment, it's very good, especially if you're hypertensive. Whenever you are given an appointment, it's good that you actually honor that appointment. And
okay, thank you very much.
Your drugs will be modified.
There's actually a right after that question, but I think you addressed it already. It says, if yes, how long should a certain prescription last? Do you want to say something about that again?
Yes, so like I said, it varies. It's not some, depending on the severity, they can give you a shorter appointment. So if you need to be fully observed, sometimes they actually have to admit people to observe them on an hourly or a daily basis. So it depends on the severity. For people that have maybe mild or moderate, you can want to give them longer appointments. But for people that are in a crisis, you want to actually monitor and observe as an emergency. So it depends. Your appointment could vary between 3, 6 months, and even above. But it's just good that when you are due for an appointment, or you start to notice maybe you are having an adverse effect to the medication you're giving, or you still have the headaches, or the headaches came back, all those symptoms you thought you were being taken care of. Even in between your appointments, if you notice that, look, something is just not right here, I think it's just good that you see your doctor.
Okay, thank you very much. The questions are popping in. Please keep dropping your questions. I have another one. It says, can number of 140, 100 be brought back to normal?
Yes, we have you have medications that may be used to bring back your blood pressure down. Yes, but like I said, those medications are not going to be taken over the counter. So you have to see the doctor that would carry out your further examinations to find out if there's an underlying cause of the hypertension. So it's not just you have a high blood pressure now and they are treating the high blood pressure. What if it is a kidney condition that is causing this high blood pressure? So it will just make sense to treat the kidney condition, and then your blood pressure would go down. So once you notice that you have a high blood pressure constant of that 140/100, then you need to see the doctor. You need to carry out further investigation, and most likely you may be placed on medications, and your blood pressure will come down if you adhere to the instructions given to you. Your blood pressure will come down.
Thank you very much, Dr. Judith. I still have more questions. Another one here says, at what age should one be worried about having hypertension?
Well, we should all be worried about having hypertension. Like I said, it's age is one of the, increasing age is one of the non-modifiable factors that we talked about, if you remember. And factors that you can modify are modifiable factors. Dr. Tope, are you seeing my slides? Are they moving?
Yes, your slides are moving. We can see them.
Okay. So remember that we talked about the modifiable and the non-modifiable factor. And the factors you can modify are your exercises, improving your diet, reducing your weight, and all that. But the one you cannot modify at your increasing age. So no matter what, you get older. You cannot tell your age to stop increasing. So that's why I said it's everybody's concern. As long as you're getting older, you need to be cautious of your blood pressure. You know, we've seen cases where people just drop dead, and the truth is that you just say, oh, he just died. It may have been a complication of unattended to hypertension, you know, but especially in this part of the world where stress is a part of us, you know, you go to work, you come back, you have the headache, you have the body pain, you do this, you have that. And then sometimes there's a tendency to overlook those symptoms and just associate it with the stress I've gone through, you know, for the day or for the week. But if you have a measure where you check your blood pressure regularly, maybe you check your blood pressure every morning, or you check it every other day, or you check it every other week, you know, to be sure that yes, your blood pressure is still normal. And then by the time you start noticing an increase in blood pressure, then you need to be checking it regularly. If not, you may actually overlook the hypertension when it comes in, and that is when it becomes fatal. You know, I've had people that I've known people that have been hypertensive since they were 28, 29, 30 years of age, and they're in their 70s and their 80s, and their blood pressure is under control, medications and lifestyle modification. So at any age, there is no particular age for being worried. You should be worried about your blood pressure as you increase in age, okay?
Thank you very much. The next question that I have here says, hi doctor, can you recommend an Andy blood pressure check monitor kit? And also, how much does it cost?
I have no idea.
Okay.
We have, yes, you have quite a number of them that are actually very good. Quite a number of them. Once just go to a good pharmacy, a registered pharmacy, you'll get a good one within the range of 5,000 to and above. You can get a very good one. So you can have the one for the wrist, you know, you can have the one for the arm, and you can actually get them. I'll just chip this in that when you're doing your home tests or you are doing your home blood pressure monitoring, it's always important that whatever you put on your arm must be on the same level. You know, your arm is like on the same level as your heart, you know, almost on the same level. And then the BP, the sphygmomanometer, what measures your blood pressure, should also be almost on the same level, you know, so they should be in
would you like to look for probably on video, just like show us how that works? Or
oh, okay, let me see.
Yes.
Can you see me?
Yes, we can see you now.
So so I have my BP monitor. So I'm not just I'm also practicing what I preach, okay? So this one can be used, this is like a home kit. It can also be used in the hospital, but so like I was saying, I said that can you see my hands, Tope? No, I don't really.
Yes, we can all see you. Everyone can see you.
Yes, so when you're checking your blood pressure, like I said, okay, most times they come with guide on how to use it. So they tell you where to put your the wire of your BP monitor, okay, and so you follow the guideline, like you can see. I'm sure you can see that. So it explains how to put it. You can follow the guidelines. There are different cuffs you have for adults, you have for children, but for us, we're talking about adults here, okay? So you can see that it's almost on the same level with my heart, my chest, and almost on the same level with the meter. So they are all on the same plane, okay? And then that will give you a more accurate reading, okay? So most times, if you're lying down, you know, you lie down, and then this is also just beside you, still on the same level, okay? So that's how to use the cuff, okay? So I guess, I hope that answers your question. You can actually get this anywhere. Once you go to any good pharmacy or hospital, you can get a very good blood pressure monitor. Okay. All right.
Thank you very, very much. I still have more questions, by the way. The next one says, we know that the new Apple Watches now have BP sensors in them. So on the go check, how effective are these watches in checking our blood pressure?
Well, actually, they are.
One. I would like you to combine this with another question. The blood monitoring equipment, if the battery is low, for example, does that have any effect on the reading?
Okay, so let's talk about the watches, the fitness bands. Those fitness bands actually come in very handy, and the BP monitors are almost as good as should be. So yes, recommended. And you know, those ones can actually monitor. You have some that monitor your blood pressure without you even knowing, and then they start to alert you when it's high or when it's deviated from your normal. Okay, so yes, they can. They can measure your oxygen saturation. We have some that measures your oxygen saturation. You have some that measure your stress levels. You know, so yes, they are very good. Then the blood pressure monitors, when their batteries are low, it actually signifies, just like your phone. Once you have a phone battery, it tells you low battery, you know, and it starts to warn you, and after a while it goes off. So it's not even going to take your measurement. It won't give you a false measurement, in as much as the battery can still power the monitor. It will still give you the accurate reading. But once the battery goes beyond, the monitor goes off automatically and doesn't come on. So that's that. So you have to change the battery before you can be able to use it. But a low battery doesn't mean that it's not going to give you an accurate measurement. It will still give you. Okay.
Great. Thank you so much. I go to the next question. Can high blood pressure cause glaucoma? I think that was mentioned during your class.
Yeah, we talked about retinopathies. Those retinopathies is just like a collective set of eye problems. So yes, it can actually lead to glaucoma as well. Okay, it can.
Great. I have a question here as well. How are these linked? You talked about diabetes, you talked about underlying conditions. So how are this linked? Diabetes, high blood pressure, stroke. How are this linked? Does that mean that if anyone has diabetes, is prone to having high blood pressure, or it will eventually end up with stroke? Can you please explain a bit more on that?
Well, they are not directly linked. Okay, so you can have someone that has diabetes and doesn't have hypertension, and they are both, you know, they are conditions. Diabetes is another condition on its own that has to do with your with the insulin levels and all what have you on another level. Okay, but what happens is that when you have other conditions, like I said, they predispose you to hypertension. Meaning, doesn't mean that you can. So you can have hypertension and eventually have diabetes, or you can have diabetes and eventually have hypertension. It's not a hard and fast rule that, oh, if I'm diabetic, I will definitely be hypertensive. No. So you have some people that are just diabetic, you have some that are just hypertensive. The mechanism of action of diabetes and the link with hypertension is quite, I think it's may be a bit very confusing for those that are not medical practitioners. So going deep into it may actually not achieve so much. But what we should know is that now for stroke and hypertension, stroke is just a complication of hypertension. So you are hypertensive, you are uncontrolled. Uncontrolled means you have uncontrolled conditions, means you have a condition and you are not treating it, you are not monitoring it. You know, it can get worse, and one of the complications is stroke. You know, and stroke has to do with where you have, I think I mentioned it somewhere on my screen. Let me see if I can get it out. Okay, so yes, let's see. We talked about where you have reduced blood pressure, reduced oxygen level, reduced blood getting to the brain. Okay, so where you have the arteries that supply the brain have, we talked about where you have hypertension, because I want to try to equate it. I want to try to bring it to as lay as possible. So hypertension means high blood pressure. So the heart is pumping blood at a particular pressure. But because the pressure is, the vessels are getting narrowed over time, as the blood pressure is getting worse, the vessels are getting narrowed. And the narrower the vessel, the increase the pressure. At some point, these vessels can even block, depending on whichever part of the body they go to. Anywhere you have narrowing of blood vessels is going to cause problem in such areas. So if you have narrowing of blood vessels that supply the heart, because even as the heart is pumping blood through the major vessels, it also needs its own blood supply. So if you now have reduced blood supply to the heart, is going to cause heart problems. It's still going to cause further heart problems, ischemia, and so many other things. If you have reduced blood to the brain, then you are looking at a stroke. Okay, sometimes the pressure is so high, and these vessels, as they are getting towards the end organs, they become tinier. So the vessels around the heart are quite large, then they reduce into smaller vessels, then they reduce into smaller vessels further and further and further. By the time they are getting to your end organs, the vessels are very tiny. So by the time you're having so much pressure in such vessels, there is a tendency for it to balloon out and even rupture. So if it's completely blocked on one end and it cannot go further, and then the pressure, it doesn't stop the heart from still pumping. So by the time the pressure is high, it balloons out in some areas and may rupture. So you may have a ruptured aneurysm, which may eventually lead to death. For reduced blood supply to the brain, it may actually cause a stroke.
Thank you so much, Dr. We can just allow you to go on and on and on and on again, but we still have to leave this class today. And we have a couple of other questions. So in recent past, we've heard about young people just dying in their sleep. People in their 40s, 30s, sleeping and they never woke up again. A lot of time we also hear that this is due to heart attack in their sleep. Is this also linked to a case of high blood pressure?
Well, for unexplained deaths, we really never can say what caused the death unless an autopsy is done. So I don't think anybody would confidently or categorically tell you, oh, he died of a heart attack, unless an autopsy was done and you can actually determine the cause of death. So, but you can't rule that out as well. You cannot rule that out. Okay.
All right. Thank you. There's another question. I understand that if you start a drug of high blood pressure, then you will not have to stop it until for the rest of your life. What are the side effects of these drugs?
Well, there are lots of side effects. Most different drugs, classification of antihypertensives is another kettle of fish on its own. So you have the calcium channel blockers, you have the ACE inhibitors, you have different types, categories of hypertensive drugs, antihypertensive drugs, and then also depending on if the person has an underlying condition and another condition, together with the hypertension, but most drugs actually, let's even leave antihypertensives. Most medications we take actually have adverse effects. Most of them, there are quite a few, or if none. And by the time you're talking about medications, the pharmacodynamics of drugs, you will always talk about the adverse effects. They always have adverse effects. So just like every other drug, antihypertensives also have adverse effects, okay? And they range from so many things, different adverse effects, which your cardiologist or your doctor would actually discuss with you. So before writing your prescription, they will tell you all the pros and cons, so the things you need to expect with these drugs, you know, and they'll discuss it with you, so you are aware of it. Some side effects are actually so bad that your drugs may actually have to be modified, okay? But there is no drug that doesn't have adverse effects, and we have various adverse effects for various antihypertensives as well.
Thank you very much, Dr. Judith Oviawe. It's been a great pleasure having you on the show today. I want to believe that every one of us in the class today has actually learned one or two things. So thank you very much. And we also believe that anytime we call on you again, you'll be there to answer us. So thank you so much, class. This actually takes us to the end of the show today. This is a great show. We have quite a number of viewers on Facebook as well. And the video will be available for you on Facebook. You can go to Facebook to check. My handle is Tope Bandele. You can also go on YouTube. This video will be uploaded on YouTube. Then you can view and also get a lot of knowledge on this. Thank you very much. And I want to use this medium to say this is the first edition. This will continue. We hope to be able to bring another guest to the show sometimes next week again. It will be communicated. And if you want to be on the show, just you know how to reach out to me by WhatsApp, by different handles, or by email as well. And if you also have recommendation, advices, feedbacks, please feel free to drop us a comment. Thank you so much. And I would like to put out a disclaimer on this as well. This is a free show. If you receive any requests or information asking for payment or registration, please kindly ignore it. There will never be any time where funds or payment will be requested. Thank you so much, Judith, and thank you to every of our viewers and our listener as well. Till I see you again next time, be good to everyone, and also always seek out to learn more. Knowledge is power. Thank you very much, and have a great weekend.
Thank you very much.
Slam dunk, are you ready to make me?